Thursday with a wow session, a word on wellness. I'm actually trying a new platform here called StreamYard for some of you. Instagram, we're doing it the same. So just say hey to me, type in the chat. For those of you who are on, shout out to Dr. Woods Wellness Community and also shout out to the Natural Hormone Fix. Today, I want to talk a little bit about Breast Cancer Awareness Month. It's Breast Cancer Awareness Month. And I want, hey, excuse me, please, etiquette. Thanks for joining us. How's it going? I want to talk a little bit about breast cancer awareness and just make you aware of some certain things as it relates to breast cancer awareness. A lot of folks that I talk to when we talk about breast cancer awareness, when we talk about prevention, oftentimes, folks are like, well, I don't have a family history, so I'm good. And actually, I want to clue you into a few things. So even if you don't have a family history, there are a few things that you need to be aware of as it relates to breast cancer and those risks. So again, you can jump in and chat with me, ask any questions that you might have about it as well. I'm happy to address that. So here's the deal about breast cancer. First of all, it's a pretty prevalent cancer. And we think about what are some of the top leading causes of death from cancer for women, it's actually going to be breast cancer, it's lung cancer, breast cancer, colon cancer. Those are the top three for women. For men, it's lung cancer, prostate cancer, and colon cancer. So breast is a huge one. One thing to note is that breast cancer is really common. Like 1 in 8 women will get breast cancer. A lot of folks don't know that. So again, it's not enough just to say that you don't have family history, because guess what? Most women do not have a family history of breast cancer. And particularly when we think about the genetic defect, if you heard of BRCA1 or BRCA2, that only accounts for maybe 10% of all breast cancers. So most breast cancers are not going to be genetically related. Oftentimes, they're not really running in families, but there are certainly things. Hey, Sylvia, nice to see you. There are certainly things that you can do. She says, wow, that's right. Most breast cancers are. They don't run in families, and only 10% are genetically related. So with that being said, then the question is, well, what do we need to do to reduce this rate of breast cancer, given that 1 in 8 women will have breast cancer? So there are definitely some things you can do, and I want to talk about what some of those risk factors are so that you can be aware of that. Let's talk about what the screening should be, how often should you be getting checked for it, et cetera. So one of the things that you can do right off the bat, and some common risk factors for breast cancer, actually obesity is a common risk factor. Smoking is a common risk factor. People, and this is, well, some of these are in your control, some of these are not so much in your control. So actually women who have children later in life, or who don't have children, they're at a little bit higher risk. So like I said, some of these things you can control, some things you can't, but those are some of the risk factors related to breast cancer. So just basic things like looking at your diet, making good choices, monitoring your weight can make a huge difference. If you're smoking, stopping smoking can make a huge difference as well. And then what is the screening that you should do as it relates to breast cancer? So mammograms is really the best thing that we have right now. And it's recommended that you start at the age of 40, and maybe you go every other year, depending on your risk factors. And then once you get to 50, it's pretty well agreed upon that you should do it every year. And then once you get, 65, 70, once you start getting into those decades of life, then the question is, do you still need to do that if you haven't had any risk for it? So those are the really important things as it relates to understanding breast cancer and breast cancer risk. And so when we talk about other prevention. And I'm curious if you guys were aware of that, or if this was a surprise to you that 1 in 5 will have, 1 in 8, I'm sorry, 1 in 8 women will have breast cancer. I'm curious if you knew that or not, or if that was a surprise to you. Again, this is Breast Cancer Awareness Month, so I want you to be aware of that. And, there is some controversy about whether or not, Sylvia said that was a surprise to her. There is some controversy about, great picture, by the way, Sylvia, on your Facebook profile. There is some controversy about whether or not women should examine their breasts. So this particular governing body has said that they don't recommend women to examine their breasts because they feel like there is harm in that. Cheryl says that seems really high to me as well. Yeah, 1 in 8 is quite surprising. That's not to say that every woman who get that 1 in 8, they're going to die from breast cancer, but just the diagnosis of breast cancer is pretty prevalent. It's 1 in 8. So, that's something that you need to be aware of. And so, like, as I was saying, some of the governing bodies are saying that they don't agree that women should examine their breasts at home. For those of you who know me, I am a board certified obstetrician gynecologist. And so, I don't see patients for, annual exams anymore, but I will tell you what my opinion is as it relates to that. So I think it is a good idea for a woman to examine her own breasts. Just to be familiar with the architecture, to be familiar with what is considered normal for her. So you can examine, and then when you go to the doctor and they do their exam, you guys can agree, like, okay, this is just kind of lumpy bumpy, and that's just me. Or you can say, hey, this seems a little bit more pronounced. Is that normal or is it not? So I think doing a self breast exam, as long as you're doing that and understanding that when you do that exam, and let me tell you why they said there may be harm in it, is because they thought that women would find things that were benign and then they would start to get unnecessary tests. So, again, if you are familiar with your own breast tissue and if you find something that's a little bit abnormal, I think it's a good idea to talk to your doctor about that. Now, again, that's not what the governing bodies say. I'm just telling you, as a practicing gynecologist, those are the things that I would recommend. And I think most of my colleagues as well would say, be familiar with what's happening with your body. Hey, on Instagram, December, Baby Ann says, speak on cysts in women if they don't want to do birth control. So December, I'm wondering if you're referring to, so commonly when women have cysts on their ovaries, oftentimes a doctor may advise them to go on birth control. So I'm going to switch gears and answer this question because it's related to ovarian cysts. So every month when you ovulate, your ovaries produce cysts, and it produces a dominant cyst, which would then be ready to be fertilized for pregnancy. But again, if you don't get pregnant, that cyst is supposed to reabsorb and go away. In some cases, those cysts do not reabsorb and go away. They can get bigger, they can get filled with blood, they can rupture, and they can cause pain and other problems. So sometimes a doctor may recommend that you do a birth control pill just to shut down that ovulation and the growth of cysts, which would theoretically shut down the production of further cysts. It's not a guarantee, but oftentimes it may work. So, December, I hope that answers your question as far as why they may be thinking to put you on a birth control pill or to stop your ovulation in that way. Again, this is about ovarian cysts. Sylvia, you said, so you can tell the difference. And I think you're referring back to the breast tissue. Sometimes it's hard to tell. And so that's why it's important to, be familiar with your own breast tissue and then also have a conversation with your gynecologist or your doctor who's doing the breast exams in the office so that you can understand what's normal and what's not normal. Okay. The other thing I wanted to say a little bit about breast cancer and as it relates to hormones, because I think for a lot of folks, if they have a family history of breast cancer, their thought is that they can't do any hormones at all, or they may be very fearful of that. So I want to speak a little bit about that because bioidentical hormone replacement therapy is something that I do as well. So what's really interesting about hormones, and this is where, I feel like the information has been a little bit skewed, if you will. The idea that we have to understand that there's a difference between synthetic hormones and bioidentical hormones. There's a huge difference there. And I'll give you the example of progesterone. So, bioidentical progesterone has a lot of great benefits for the body. It has a natural calming effect. It has a natural sedative effect. And I can't tell you how many women I talk to who are, especially in their 40s plus, mid 40s age range. I'm in that age range, but I sleep pretty well. I have just trouble getting to sleep. But I have women who are waking up at 2 or 3 o'clock in the morning, and progesterone has a natural sedative effect. And so that may be what's missing for them. Bioidentical progesterone can do that for you. Whereas a synthetic progesterone, which is technically called a progestin, it actually can cause disruption in the mood. In some cases, like in a Depo-Provera shot, it can actually increase issues with depression. So we used to not give that type of progestin in young girls who also had a history of depression. So, and another interesting thing about progesterone bioidentical is that it actually has some action against breast cancer cells. And you can look this up, progesterone. That's not to say if you have a breast cancer that has receptor positive, you cannot take hormones. These are two different things. And I don't want to get too deep into it for the moment. And then testosterone, which is another hormone, has been used in some experimental studies for its action against the breast cancer cell. And my only point in saying this is that there are a range of hormones that we use for women who are going through menopause. And if you have a family history or if you're concerned about breast cancer, it doesn't mean that those things are off limits for you. And then also there's some natural herbal things that you can do as well. So don't feel like you have to suffer through the menopause piece if you're having symptoms because you're afraid of breast cancer. And again, there's certain hormones that I don't give to women who are breast cancer survivors, but there's ways that we can support that. I just want to make sure that you're aware of that. December asks over on Instagram, natural ways rather than birth control. That's a really great question, December. And unfortunately, we don't have really a natural way to shut down ovulation because that's what the birth control pill is doing. In the case of, she had asked a question about ovarian cysts. Now, what you might do just from a inflammatory standpoint is, what can you do just to reduce inflammation in your body overall? I don't know, December, if that would have a big impact on the ovarian cysts themselves, but things we do in general to reduce inflammation is taking lower inflammatory foods. So that's like taking out gluten, taking out dairy, taking out processed foods, getting in a good amount of sleep because your body does a lot of healing and repair during that time. But if you're in a more urgent situation where you've got cysts that won't go away, the birth control pill really is the only way to shut that down. And you might talk to your doctor, December, to see if that's something that they just intend for you to use maybe for a short period of time versus a longer period of time. Okay. So, what other questions do you guys have about Breast Cancer Awareness Month? I guess we've got some questions about hormones in general. And then I'm trying to look at my other pages as well, because I know some of you are not on StreamYard. So please give permission to StreamYard so that we can share your comments on the page here also. Let me see and make sure I didn't miss anybody. All right. So again, I come to you every Thursday with a word on wellness. You're welcome, December. A wow session, a word on wellness. And what the point I really wanted to make today is that even if you don't have a family history of breast cancer, you need to be aware that most people don't. And I also want you to be aware that the best thing that you can do really for to reduce your risk of getting breast cancer are the things that you would do to really optimize your health anyway. So, obesity is a risk factor, smoking is a risk factor, taking in processed foods, toxins in the environment. These are all risk factors for breast cancer. And just like you would want to lower and mitigate those things just to get your body optimized in general, by doing those things, you can also lower your risk of getting breast cancer. And then I also want to reiterate the recommendations for screening for breast cancer. So starting at the age of 40 with a mammogram, maybe every other year in the 40s, definitely in the 50s every year until you get, probably into your 70s or a little bit higher. And then also, If you have a family member, a first degree relative, so that's a mother, sister, or daughter who is diagnosed with breast cancer, then your screening should start about 10 years before theirs. Cheryl says she's been afraid of replacement hormones since she had breast and ovarian cysts. And that's completely understandable, Cheryl. Hormone replacement therapy is not necessarily going to increase your risk of breast or ovarian cysts. But again, that's totally understandable. And this is a conversation that you would want to have with a physician who's familiar with bioidentical hormone replacement therapy. Thank you for sharing that. And then Cheryl said, why is it hard to lose weight after menopause? Oh man, she says, I used to be able to lose weight easily. This is one that we hear all the time. Here's the deal. What happens when you go into menopause, though your hormones are declining, the estrogen, the progesterone, and the testosterone, estrogen often declines faster. So, this will be estrogen, this will be progesterone, and they tend to be kind of this way. So let's say they're declining, but estrogen will start to decline. I'm sorry, I'm saying that backwards. Progesterone will decline faster, so you become estrogen dominant. And so when you're estrogen dominant because you're losing progesterone faster, that means estrogen is a fat storing hormone. So for those of you who have had children, if you've been pregnant, one of the things that happens is that your estrogen skyrockets because you're storing fat and your body's getting ready to deliver that baby. So when you go into menopause, again, things are declining, but progesterone is declining faster. So in essence, you're estrogen dominant, and estrogen is a fat storing hormone. And then the fatty tissue in your body. So not only does estrogen from the ovaries promote fat storage, the fat itself also produces a little bit of estrogen. And then you've got the inflammatory processes happening in that fatty tissue as well, which the production of estrogen is making that bigger. So it's kind of like this vicious cycle of inflammation and fat storage that needs to be broken. And some of that's going to be with dietary changes. Sometimes it's with hormone support, anti-inflammatory support. There's different things you can do. But Cheryl, I totally understand that sentiment. And I hear that from my women in the office all the time. So again, coming to you every Thursday with a word on wellness, a wow session. So glad to have you guys join me today. I want to make sure that I got everybody's questions answered. So my point is, for Breast Cancer Awareness Month, what I want you to be aware of is that breast cancer is very common. 1 in 8 women will get breast cancer. And I want you to know that most breast cancers are not genetically related. Most people don't have family history necessarily. So I want you to understand that there's basic things that you can do to reduce your risk of getting breast cancer. And it's really the same things that you would do just to optimize your health in general. So those are my take home points. So make sure you're making good choices as far as taking care of your body, getting in good sleep, reducing stress. Cheryl says, oh, wow, thanks for explaining this. I appreciate it. You're very welcome, Cheryl. And thanks for joining me today. I'll see you next Thursday, same time, same place. You all have a great day.